Assalamu alaikum. In this video, we are going to discuss about fibroadenoma of breast. Fibroadenoma is actually a commonest breast mass of young women. It is common in the age of 15 to 30 years. It is also known as breast mouse. Why it is known as breast mouse, I will tell you later. But first of all, let us have some anatomical overview. You can take screenshot of this picture as it is very clearly descriptive picture. It not only indicates the anatomical overview of the breast but as well as lesions locations according to the anatomical sites are also given in this picture. Fibroadenoma of the breast is mainly intralobular stromas tumor. In our breast there are two types of stromas. One is interlobular stroma and the other one is intralobular stroma. So in this video or in this picture, let me first of all tell you that what is inter and what is intralobular stroma. Actually, you first of all you must know that what is a lobule. 3 to 5 acini like here in light pink color as in this picture. Here light in light pink color. 3 to 5 acini together join along with their terminal ducts. All of these things join 3 to 5 acini and along with their terminal ducts they together form a lobule. Right here lobule, lobule, another lobule, another lobule. So within this lobule, the stroma which is present is intralobular stroma. As you people will might be knowing already that intra means within and inter means in between. So here, what is within and what is in between? Actually, intra means that within this lobule or inside this lobule, and inter means there is an other. See that here is an other lobule, and in between these this one lobule and this one lobule the stroma which is present is known as interlobular stroma. Like here you can see that inside this sky blue colors outlining is intralobular stroma, and here in yellow outlining or yellow white yellow dotted lines it is interlobular stroma. And here it is shown in this picture that in intralobular stroma fibroadenoma and phyllodes tumor can occur, and in interlobular stroma and fat necrosis can occur, which is nothing but inflammatory lesion of the breast. Okay, so now let's move towards its gross morphology. Here are 3 to 4 features that you must remember in its gross morphology. Number one is that it is very well circumscribed here. Number two is that it is freely movable tumor, and because it is freely movable tumor, it is known as breast mouse. Number three is that it has somewhat rubbery feel. Okay, because why it has rubbery feel? Because here mainly stromal component is involved. Okay, so yes, inside this stroma there is nothing but adipose tissue, and wherever there is adipose tissues collection, you can see in any site of your body where adipose tissue is present in abundance, here is somewhat rubbery feel, and similarly in this case occurs. And this was somewhat its gross morphology. I hope so that this will be clear to you people. Again, I will show you here your big robin's picture, which states that on cut section of this fibroadenoma somewhat grayish white nodules bulges out like here shown. Well circumscribed grayish white nodules can be seen on cut section, and behind it this is normal adipose tissue. Okay, so now let's move towards its microscopic features. Actually, in microscopic features, you must know somewhat 2 or 3 features. Number one feature is that it is a biphasic tumor. Why we call it biphasic? Because it shows two types of proliferation. One is fibrous tissue. One is inside the fibrous tissue, and the other one is inside the glandular tissue. Okay, so, as this tumor shows proliferation in fibrous tissue as well as proliferation in glandular tissue, so it is known as a biphasic tumor. Or you can say that this tumor has two components. In this tumor, two types of components are involved. One is fibrous tissue and the other one is glandular tissue. But two growth patterns are also seen in this tumor. One is intracanalicular pattern and the other one is pericanalicular pattern. In pericanalicular pattern, we call it as hard tumor, and in intralobular tumor, we call it as soft tumor. You can remember it as pericanalicular starts from P and hard starts from H. Intracanalicular starts from I and soft starts from S. So pericanalicular hard tumor and intracanalicular soft tumor. First of all, let me show you somewhat easier picture. It is very beautiful picture of histology, which shows here that Here you can see that stroma, as this tumor is mainly of intralobular stroma, so here fibrous proliferation, here stromal proliferation can be seen very easily. And moreover, you can also see here that these are the ducts, but here this is the duct, all of these are ducts, but here this trauma is growing so much fast that it is compressing these ducts. So it has shown that there is intracanalicular pattern. In intracanalicular pattern, mainly you will see that the glands are compressed. Like here, the glands are compressed and their lumen can be seen very hardly. Like here, okay, like here, this is intracanalicular pattern. And the other one pattern is pericanalicular pattern. Here is here stroma is simply surrounding the duct. Here the glandular lumen can be seen easily. Like here, glandular lumen can be seen easily. Here can also be seen, here can also be seen. So here the pattern is of pericanalicular pattern. I hope so that this will be clear to you people. And again another picture where you can see that as the stroma is growing very much fast, so it is compressing the glandular structure, and as a result there is no lumen left behind, or very hardly lumen can be seen. So it is mainly intracanalicular pattern. Okay, here you can also see that stroma is growing so much fast. It is compressing the glands, and glandular lumen can be seen very hardly. It is intracanalicular pattern, but here it is pericanalicular pattern, right? Again, you can see here that there is stroma or loose connective tissue that is proliferating, and here the glandular structures are not compressed and their lumen can be seen easily. Again, here, so it is somewhat pericanalicular structure shown here. Again, here all the glands are compressed and slit-like spaces are formed here. Okay, so it is mainly intracanalicular pattern. So again, you can see from here as well that here somewhat slit like pattern is shown, and it is intracanalicular pattern, I must say, mainly. Okay, so again here, this is another picture of fibroadenoma. This is another picture of fibroadenoma. You can take screenshot, as it is somewhat different picture from other pictures I have shown you. It looked somewhat challenging for me, so I have added its screenshot here. Okay, so again your big robin's picture is shown here. It is intracanalicular growth pattern. Here is somewhat pericanalicular growth pattern. I hope so that you can easily appreciate it now. And one more thing I want to tell you here is that these 3 to 5 acini together meet and they form one lobule. And inside this lobule there is intralobular stroma, and in between there is one lobule, another lobule, and in between these lobules there is interlobular stroma. And all and these acini and terminal ducts together meet and they open into somewhat larger ducts, and these ducts are known as lactiferous ducts, and these ducts are mainly lined by two types of epithelium. One is luminal epithelium and the other one is myopithelium, but we will discuss it in the later videos, inshallah. And here are some types which I want to mention here, and which are also asked in your exams, that what are the types of the fibroadenoma. So types of the fibroadenoma include juvenile type, which means in young age; complex type, in which the fibroadenoma is admixed with some fibrocystic changes as well, and the number third type is cellular type. In this cellular type, there is stromal hypercellularity. Normally, here is stromal hypercellularity occurs, but in Phalloids tumor, which is its counterpart, and which is another type of intralobular stroma, their stromal hypercellularity is a main feature. But in one of the types of the fibroadenoma, the stromal hypercellularity can occur, and it is its cellular type. Okay, so thank you very much. That was all about fibroadenoma.